So I'm super happy today to be hanging out with Miss Linda Sasse with Community Health Foundation Sierra Leone. And Linda, we've worked together now for, what is it, 2 or 3 years?
About 3 years.
3 years. It's
Yeah.
amazing how fast that's gone by.
Yeah.
And so you are the president, CEO of Community Health Foundation Sierra Leone. Um, Now, I know your story very well, so I'm going to narrate this and condense it down just a little bit for you. But you grew up in Sierra Leone. You came to the States. You got your nursing degree. You've got some other advanced degrees in nursing that you can talk about.
Okay.
And you basically came over here to get into the medical profession to, number one, obviously get that experience and that skill, but also as a way to give back and go back to Sierra Leone and start a health foundation. And I know there was some very personal stories that kind of led you to that you experienced growing up in Sierra Leone. So, do you want to go ahead and talk about growing up in Sierra Leone, some of the things that happened that sort of got you into this career path, and maybe go into a little more detail?
Sure. Thank you very much, Sean. Yes. I was born and raised in Sierra Leone. Growing up in Sierra Leone as a young child, I saw the desperate need for healthcare. I have this my story of my aunt who died during labor. I was
Mhm.
about like I was like um 8 years old. So my aunt was in labor for 3 days, but where we are, there was no medical attention. We only have like those grown up, I mean, old people, women who have given birth to multiple kids. They will consider them as midwives based on their experience during but I mean childbearing. So those were the only people they consider as midwives. So they were the one doing the delivery for people, for ladies. So this my auntie was in labor for 3 days, and there was no medical. So long story short, and the baby was in the transverse position. She couldn't give birth to the baby up to 3 days, and the baby died. Unfortunately, they were trying to take her to the big town that is close. That is it's about 3 hours drive from our village. So it was very difficult to get her to that hospital. So on the way going, she died on the road, and my aunt was really bleeding. She was bleeding when they brought the body back, and of course, nobody knows how to control bleeding by then. So the baby died, and even when she was, I mean, when they tried to take her to the burial during the process, the blood was dripping from the house to the grave. The blood was dripping. The baby was inside my aunt's abdomen. They couldn't remove the baby. So she was buried with the baby. I mean, I don't know whether the baby, well, definitely I know the baby will have died as well. So as a young girl at that time, I was really devastated, and that really pains me. So I
Mhm.
said to myself, I said, when I grow up, I really want to be a healthcare practitioner. So that way I will help my people to prevent such a tragic event again. So I was fortunate to come to the US, and I jumped straight to the medical field. And for right now, I basically started as a nursing aide, and I ended up now having my master's in nursing. So I decided to form an organization, not profit organization, called Community Health Foundation, which I started about 3 years ago. It was registered in the US on 2019, October. This is a non-profit organization. I use it to ask for donations of medical equipment and supplies. So for the past 3 years, I do receive donations of medical supply also from you. Anyway, I'll come to iMedical. So these medical supplies, I also send them to Sierra Leone as a donation. That's what I've been doing for the past 3 years until recently I was able to put up a 30-bed facility, a hospital for maternal and child health. So I just came back from Sierra Leone. We opened this hospital on April 29th, this past April 2022. So since we started this facility, it's really helping the community. We were able to save lives. I got some Nigerian doctors that are working there right now, a surgeon, and some Sierra Leoneans healthcare workers that are working there right now. We do surgeries like, for example, cesarean section. We are, even as I'm talking to you, yesterday they did another successful cesarean section. The baby was safe and the mother was safe. So now the community, most people come to us for medical attention. Mm-hmm. We do even for men, even though we are focused on maternal child health, but because of the lack of medical facility in that area, we have to provide care for all the population. Mm-hmm. Men do come there. Last week, we did an hernia surgery for a man, and also an appendix. We did that surgery. So we have to like provide care for all population. Mm-hmm. Because there is no other facility close by. So that's where we are right now. And of course, we treat malaria, typhoid, in all kind of sicknesses in that area. That's where we are right now.
So you've stayed in touch with me very close since we first met. And I know you sent me photos of the first C-section that you did.
Yes. That was a great feeling when we started that facility. Where that was the first C-section we did, and it was successful. So I'm so happy. And also, I do remember you, because starting from the ongoing, when I started this foundation, I registered the organization, but I didn't even know what to do. I got my charity number, 501c3. I didn't know what to do. I used to go on Facebook Market, buy medical equipment in a cheaper price, drive to different locations to buy them. And because I didn't know what to do to get donations. So I was able to meet you in Virginia, Richmond, Virginia, when I came there to buy medical equipment. That was, it was an exciting moment when I met you. I was with Francis when we went there to buy those medical equipment. Yes. And you decided to donate those medical equipment to us. And you did not just donate those medical equipment to us, you also empowered us. You told me that, Linda, this is just the beginning. You will get to the next step, and you empower me, you embolden me. You showed me the way, what to do to get donations. So I really, really appreciate iMedical Healthcare Solution. I really, really appreciate you, all the motivations, all the empowerment, everything you did. And since that time, you still work with me. All the donations you've given to me, they've been in use in Sierra Leone, and they are really useful. They are saving lives right now. So I'm really, really grateful. I'm really grateful to iMedical Healthcare Solution, especially with you, Sean, and all your team.
Linda, it has been such a journey. It has been such a journey. And I'm super happy that we're doing this call, because you started, when I first met you, you and Francis were digging through garbage bins to get wheelchairs and canes. I mean, you guys were literally out there working full-time as nurses, raising kids, and in your spare time, you were out there trying to get collect donations and things. And it was such a humble start, and your heart was so big.
Yes, you're right. So like I was saying, when I started this organization, working as a full-time and a mother of 2 babies, it wasn't easy. I have to pay bills, and I didn't know how to get money to buy those things. I mean, I used to buy some of them.
Yeah.
When I pay my bills, the little one who left, I will go ahead and buy them. But I also used to go to the garbage, like trash cans. Yeah. I go there and pick medical.
I remember you told me that. I just thought, this is crazy, so, but you were doing it. You were actually finding stuff there.
Yeah.
And you know what really helped fund a lot of this is some of the donations that you got during COVID. You got a bunch of hospital beds.
Yes.
And different things, and that really helped generate some income for you, which some of it was able to be shipped, some of it you were able to buy from us. But you know, I mean, unfortunately, when you first came, there was a lot of stuff that I had to just say, Linda, this is going to be a project. It's not, it's like
Yeah.
it's going to take steps, and you have to kind of just adjust to what it's going to take, and what the process is going to be. But you followed through on it, and I think the best part of the story is that you single-handedly made this happen. Like you
Yes.
single-handedly, you had help, you had people along the way, but you personally made it happen. You followed through. And I still remember when we first started getting the pictures of the building as the building was being built. Remember, there was when I first met you that first time, there was the drawing, like the conceptual drawing of what it was
Yes.
going to look like. And
Yes.
then you would send me along the way, this room just got built. We just added our second story. Like
Yeah.
we watched this project start from literally just nothing, just a
Beginning.
dream,
Yes.
into literally being built step by step. Um, it's nice now that you're on the other side, but it's really important for people out there. You've met Albert, I believe, correct?
We talk.
Donna?
Yeah, we talk with Albert.
Yes. And people want to know, what does it take? What do I need to do? And I deal with some people that don't take their own initiative. They want everybody else to do everything. And then I deal with people like you that do everything and then use people like us as a resource. And I remember, so many times when the first containers were being shipped over there, that was a big deal. And
Yeah.
then you got the facility built, and then it was like, okay, well, we still need disposables, we need hired professionals, we need to, like, it was a process. And
Yes.
now you're working directly with the Sierra Leone government. We've got projects now that we're doing over in Sierra Leone that you've basically helped set up because they have seen what you have done.
Yes.
And who's our friend over in Minneapolis?
Serene.
No, the other Sierra Leone person, the lab guy,
Oh, Alpha. Alpha.
Alpha. And you and Alpha went over there, and now from talking to Serene and talking with some of the feedback, your facility now that you're operating, Community Health Foundation Sierra Leone, is as nice as a lot of the hospitals in Sierra Leone. You've got modern equipment, and you've got really a foundation there now that's really helping a lot of people, which is fantastic.
Yeah. Thank you. Yeah. So actually, the funding is really challenging because you with me since the beginning how we started, and the opportunity that I got that makes me able to open that facilities for the fact that COVID came. Of course, we all don't like it, but fortunately, I was since I'm a medical practitioner, I was able to jump into the COVID response. I was working as an emergency responder, going from different states, New York, Texas, and all that. So because of that money that I saved during the COVID, that is what really makes me open this 30-bed facility. All the money that I saved from the COVID response, I was just investing it into this building up to where we are right now. Right. So the Sierra Leone government is proud of me. As you can see the video that I sent you, I was presented to the Well of Parliament in front of the Speaker of the House because they just wanted to acknowledge my efforts towards the health sector in Sierra Leone. So they are really, really proud of me.
That's amazing. And there's so many good things now that are coming from that. And I know that iMedical is going to open up a facility in Sierra Leone. That is one of our next locations that we're setting up, and that's greatly due to all the work that you have done, getting connected with the government of Sierra Leone and working now on projects with them, and being able to get that equipment over there. In a way now that smaller clinics and things can go ahead and afford to buy equipment, but not have to ship a full container over there. So there's a lot of things now that have come from this. But you bring up another good point. You were working full time and investing all of your personal money into this project.
Yes.
Yes, like I remember, and you worked very hard and, doing a lot of different shifts. I remember when we were talking about you were going to shift positions within the hospital and move into the labor and delivery section so that you could get that experience, which was fantastic. And while you were doing that, you were working on getting your master's degree in nursing.
Yes.
And that was what, about 2 years ago?
Yes, yes. I graduated 2019 with my master's.
God, that's amazing. It's such a
Mm.
great story. And it's actually a great story now because we're on the other side. You know, at the beginning, it's a very daunting task to think that I'm going to need to come up with all this money for equipment, pay for shipping, get the place built, find staff. I mean, that is a big task. And just the fact that you've done that is just absolutely so, it's so exciting. And being able to follow it step by step, where you're sending me the pictures and the videos of the first C sections and hearing all these stories and kind of knowing how the whole thing started. So right now you're running the Community Health Foundation. You're back in the States right now, which is why I wanted to catch you while you were here.
Yes.
What other things do you have going on? What other future projects or things are you working on over there? Are you going to build onto that facility, or what else? What do you have in your plans right now?
So thank you for that question. So my plan is to have a bigger facility. Of course, right now the 30 bed that we are running is not enough for the community.
Yeah.
And of course, we do have challenges there right now with staffing, because I have to pay staff right now out of pocket. And the running costs, electricity, we don't have electricity there. We have to have a solar power panel. We are running a solar power, and we also have a backup generator. So, but my goal is to have a bigger facility, which I already started. I started a foundation of 100 bed capacity. At least I want to have at least 100 bed or more. So
100 beds?
yes, 100 bed capacity hospital. I'll send you those pictures. I think I sent you before,
You
and
have.
I'll send you to see where we are right now. So we already started that building. The foundation is already completed.
Yeah.
It should the plan for that hospital is a 3-story hospital.
Mm-hmm.
And I'm really, really looking for partners to help me on that project, because
Mm-hmm.
I cannot do it on my own.
Right.
So for right now, we just finished the foundation, and I stopped for right now because there is no more funding for that, no more money for that. So
Mm-hmm.
I'm really, really looking forward to partner for the progress of this oncoming project.
Mm-hmm.
Also, on the existing project, the 30 bed capacity that is running right now, I'm still looking for partners who can partner with me to help us provide quality and free healthcare to the
Mm-hmm.
community.
That's fantastic. So exactly where is the 30-bed facility located? What part of Sierra Leone?
It we call it Tonkolili District. The name of the place, the town is Mile 91. That is 91 miles from the city, Freetown. So we call it Tonkolili District, Yoni Chiefdom. That's where it's located. It's really strategic, like it's the center of the country.
Mm-hmm.
Any district you want to go, it's like the center. It's really strategic where it's located. And we have a lot of accidents in that highway because of the cars always go around that area because it's the center. So we have a lot of accident victims. Almost like every week we do receive accident victims, and we are able to save their lives so far. Since we started April 29 to now, we have not lost any life in that hospital.
Wow.
Yeah, nobody has died there. We are able to save lives since then up till now. Accident victims, and of course, surgeries and other sicknesses like malaria, typhoid, and you name it. Mm-hmm. We have a blood bank. We are able to receive donations with blood transfusion, because most people, when they go through surgeries like C-section, they lose blood. We have to transfuse. And most of them, because of lack of even food, good food is not available. So most people are anemic. We have a lot of cases that we always have to transfuse blood, because even young girls, they come to the hospital and they are severely anemic. Mm-hmm. Kids, babies, severely anemic. So we have to transfuse blood almost all the time.
Mm-hmm. Mm-hmm. So where's the 100-room hospital going to be in relation to the 30-room hospital? Is it going to be in that same area, or is it somewhere close by?
Same location.
Okay.
Same location.
Okay. So one thing that I know, because I've worked obviously on a lot of projects overseas, a lot of stuff over in Africa, is that it helps a lot when people here in the States can help provide with donations.
Yes.
Like as an example, there was a hospital that donated, I don't remember the exact number, 40 or 50 beds that they had coming out. It's such a crazy story. But you and Francis had those in your backyard. You did get some storage, but you had them literally. You were picking them up and bringing them and putting them right there in the backyard of your house.
Yes.
And
Yeah.
which is just it's just such a colorful story. But whatever it takes to get the job done, you did it. But the moral of the story is that, and this goes back even to my days in San Diego working with other nonprofits over there that were also doing stuff with Africa. A lot of stuff was coming out of Scripps Hospital. And what the charities would do is, let's say they got 50 beds, and you've got a hospital for 30. They would take 20 of the beds and sell those and use that money to ship the 30 beds and to help fund to get the rest of that equipment over there. So for any of those people out there that might not have a lot of money that they could donate, there's a lot of other things you can donate.
Yeah.
We could actually probably come up with a wish list of things that you're looking for that might be something as simple as linens.
Yes.
You know better than I do,
Mm-hmm.
but if there's a hospital out there that says, hey, we've got 30, 40, 50 beds, now we could start looking at staffing and getting the 100 room hospital started to kind of get that process rolling. But some of that can go overseas, but some of it can really help provide badly needed funds that will help, number one, sustain what you're doing right now, and
Yeah.
then also help fund future projects by just getting you the equipment, because you have sources like us and others, obviously, that you work with, that we could say, look, of course, Linda, we'll sell them and we'll give you the money, or what, however we do it, which we've done in the past. Um, but we're also going to put your web address and your contact information on there, because the goal is to get the word out and to get as many people, being able to help in any way that they can. It's always, everybody has a different way that they can contribute. So the
Yes.
main thing is just understanding what is the project, getting to meet you personally, knowing who they're talking to, knowing the story. And I remember the day that you came and told me that story about your aunt, and even Francis at that time also had very traumatic stories of things that they witnessed growing up as kids, with just a very lack of medical care. And here you are fulfilling your dream, and you're now saving lives. Would you have a ballpark guess of how many people you've saved since April?
It's about it's I think I have it about 60, 62. The last time I checked, day
Wow.
before yesterday, it's about 62. And from day before yesterday to today, I have to find out what's the how many people. But from April 29 to day before yesterday was the 29, 29, yeah. Yeah, it's 62 people.
That's amazing. That is super
Mm,
exciting.
yeah.
So you're looking at that, and now you're going to do the 100 room hospital. That's also very exciting. Now, one of the challenges that goes with running these facilities is, like we've talked about, because we've talked about everything, is once it's up and running, once you've got it up and running, you've got the equipment, how do you sustain it and how do you
Yes.
keep the income? So for people out there that are looking at setting up their own clinics and their own facilities, what advice would you give them on that?
Well, I know it's really challenging, just like you said. Setting up the facility is one thing, and running it is another one.
Mm-hmm.
Paying staff, it's a big challenge, you
Mm-hmm.
know. And of course, we have to buy medication. Power supply, water. It's just a whole lot, you know. So
Yeah.
it's really, really not easy. So what I would advise to people who want to do stuff like this is to look for partnership.
Mm-hmm.
If they can get partners who can partner with them to help them, through funding and all that way they can achieve their goal. Just
Mm-hmm.
like I'm looking for partners right now, because my goal is to help people to at least get free and quality healthcare services, or affordable, you know. But
Yeah.
it's really, really not easy. So I think partnership would be the best option.
Absolutely. So when you say partnership, obviously financial backing is important. Now, what about doctors or nurses that might want to take a couple weeks and come and donate their time and efforts? When you say partners, what type of help, what types of partners would be ideal partners for you, in addition to people that can help contribute financially? but what else do you think would be good for a partner to assist you?
Well, first of all, funding, money. If we can get partners, we can say, hey, I can just help you pay staffing.
Mm-hmm.
That would be great. Or
Mm-hmm.
I can help pay for the power supply or
Mm-hmm.
whatever or buy medication or donate medication.
Mm-hmm.
That would be great. And also, like you talk about doctors, medical professionals to come in and invest their time. Because even when I came right now, I'm planning to go back in the next maybe 12 weeks or so. And in
Mm-hmm.
that trip, I want to do like a medical outreach,
Mm-hmm.
like medical missions. So
Mm-hmm.
I really appreciate if we can get doctors who can we can donate their time for
Yeah.
those kind of medical trip. Like we go there, for example, like even most people have eye problem in that area.
Mm-hmm.
People go blind for a simple cataract that is easy to remove, like to
Mm-hmm.
do eye surgeries. So that
Mm-hmm.
is something I have really seen that is really challenging in that area.
Mm-hmm.
So if we can get like a ophthalmologist or eye doctors who can partner with us, we can
Mm-hmm.
who can sacrifice to go there
Yeah.
and do that. That would be great.
Yeah. Yeah, no, that's good. And everybody, like I said, has their own area of expertise on ways that they can contribute. I think lots of times they just don't know where to go, they don't know who to contact, and they just don't have that opportunity presented to them. But that's kind of the goal of doing the video. Number one is introduce you, talk about what's going on, talk about what all the great things you're doing, and then talking about ways that people can help. And so you're going to be here for about 12 weeks and you're going to head back over there.
That's my goal, but I'm not sure because now
It's
that I'm here, I still have to work to get money before I can travel back. So that's my goal, but I'm not sure about that. It depends on how much I'm able to accomplish.
yeah,
But yeah, medical mission will really, really help if
yeah.
we can get people. Eye is just one part of it. There's a lot that needs to be done to save
Oh yeah.
people's life back there.
Mhm. Yeah.
Yeah. Mhm.
So one of the things also that we are lucky, with the company with iMedical, is that we work and have done a lot of these projects overseas, a lot of stuff, especially in Africa. And so during this process, I was able to introduce you to Modesta, right, who's got her
Yeah.
hospital in Kenya,
Yes.
who was a couple of years ahead of you, and have other people that have done these same types of projects as mentors and also as people that can help sort of guide you through that process. So, have you talked to Modesta lately? Have you talked to her?
Not recently, but we talked some time ago before I traveled to Africa.
Yeah. And how helpful was that having her and others like Modesta that were there that were able to kind of say, okay, Linda, we're going to help you get this started. Here's what you need to do next, and here's what you need to look for. How helpful was that for you?
It was really helpful. It was motivating because seeing somebody who have done what you want to do, it's
Right.
really, really motivating. So we talked and she gave me some courage and she empowered me. She told me, hey, I started just like you and now look where I am. So I
Yeah.
believe you can do it. So that was really, really helpful.
Very helpful. And she
Mhm.
actually has, I want to say it's a 120 room hospital.
Yeah.
Two operating rooms with a third operating room being set up. They've gotten some CT equipment now, and
Wow.
they're into this thing now for about 5 years. And with Dr. Baker, I need to throw Dr. Baker in there too because Modesta and Dr. Baker are
Yes.
basically connected. And Dr. Baker also helped a lot with getting the project going with Modesta. But Modesta's story is very much like yours. So what I'm going to do is I'm going to post your web address and things on there. One last thing I just want to touch on. I put you in contact with an orphanage.
Yes. I tried to call that number, but I couldn't
Joseph.
get hold of anyone.
Okay.
I
I'm
tried
gonna
like
I'm
to.
gonna forward that to your WhatsApp and maybe you can try to reach him. Do you
Okay.
do you know what part of Sierra Leone he's in?
No.
Okay. So I've been trying to help. I saw them and met them, and they send me videos, and I try to do what I can to assist them in many different ways. But
Okay.
when I knew that they were in Sierra Leone, the first thing I did was reach out to you because you were still in Sierra Leone at that time,
Yeah.
and they have an orphanage with about 18 kids. Uh,
Wow.
and they're also doing the same thing. They're trying to build their own little building so that they can move into their own building and and stop paying rent and just be able to save more money and do more to help the kids. But
Yeah.
these are the kind of stories and the kind of people that are just super inspiring because it's all about giving
Yeah.
back and helping
Yeah.
others.
That's good. Yes.
So hopefully here within the next few days, within the next week, you guys can connect and find out where he's at, and just relay that back to me and how what they need and how we might be able to help them.
Okay. I
So
will.
Linda, people that are out there, I'm going to put it on there, and but I do want you to. What is your website address?
It's www.chfslinc.org.
Okay, Community Health Foundation, CFL, Sierra Leone, SL,
CHF.
CHF, excuse me, Community Health Foundation, yes, CHF,
Mm-hmm. SL.
SL, Inc.
Inc. Yes.
.org.
Yes.
Okay, and you'll have all your contact information. So anybody that's out there that's watching this video that would like to contribute in any way, shape, or form, it could be as little as a little bit of money. It could be some really usable disposables. Just to put it out there, you're in Maryland right now. So in say Baltimore, in that area, general area. So you're in the States and you're easy to reach. And anything that's out there, it can be shipped. And also, as we said before, if there's items that you can donate, Linda does have her own nonprofit. It's a 501c3 that's based out of the States. So you're able to provide tax write-offs. You're able to give people some value so that they can actually get, number one, knowing that they're going to help other people, but also get a tax write-off, which, it certainly doesn't hurt. It does help a lot. And there's a lot of doctors that are retiring. There's a lot of hospitals that get new equipment. So if you want to do something really positive and get some real good press and just feel good about where that equipment is going to go, definitely get in touch with Linda. Linda, before we finish, is there anything else you'd like to say to everybody before we sign off?
Not really. I just want to say thank you for your time and thank you for those that will be listening to this video and be watching this video. I want to thank them all. And I want to just encourage people to partner with us, Community Health Foundation. Whatever they get to donate, it's going to be helpful. It's going to save somebody's life. That is not a little. Whatever you have is highly appreciated. That's all I have to say right now.
Well, that's enough right there. And thank you so much for your time today. If you could do me a favor, I know you've been sending me stuff on WhatsApp. Can you send me some of the videos and pictures through my email?
Okay, I will.
Which then
I'll do that.
I can get them easier because what I want to do is I want to clip in some of the photos. I
Okay.
still have a lot,
Okay.
but some of the newer stuff that you've been sending me, I'm trying to move it off my phone and the file size is too big.
I'll do that.
Yeah. So Linda, thank you so much for your time today. It's great to see you as always. I definitely want to connect with you before you go back over there. So let's find time to have you come visit us here in Virginia. And we'll look forward to talking to you again soon and getting further updates.
I will. Thank you.
Awesome. Thank you, Linda.
Bye.